If you have an epiretinal membrane and you also happen to have cataract surgery coming up, this video was made for you. In this video, I'm going to break down what an epiretinal membrane is, how it can affect your vision when it's mild, moderate, or severe, and what you should know if you're planning to have cataract surgery in the near future. And if you stick around till the end of the video, I'm going to let you know what lenses I recommend to my patients with epiretinal membranes when they're having cataract surgery. Real quick, before we jump in, my name's Brad Sifrig. I'm a board-certified cataract surgeon, and this is Cataract Companion, the patient guide to cataract surgery success. If you are a loved one or getting ready for cataract surgery, then Cataract Companion was made for you. I try to help patients better understand the surgery process to get their best results. As always, I have no financial disclosures. These videos aren't supported or sponsored by any lens manufacturing companies. All right, let's jump into it. So what exactly is an epiretinal membrane or an ERM? As the name suggests, an ERM is a thin layer of tissue or membrane that forms over the surface of the retina. There's some other names for an ERM you might hear occasionally, like a macular pucker or cellophane maculopathy. Those names make a lot of sense because as this membrane grows over the retina, it can cause the retina to wrinkle or distort, almost like crinkling up plastic wrap. But before we go further, let's take a quick refresher on what the retina even is. So while a cataract is a cloudy lens in the front of the eye, cataract surgery, we replace that cloudy lens with a new clear lens, the retina is actually in the very back of the eye. So the retina is a thin layer of nerve tissue that lines the inside of the eye almost like wallpaper, and you can think of it as the film of the eye. The retina contains the photoreceptor cells that capture images based on the light coming in. Those images are then sent through the optic nerve to the brain, and the brain interprets our vision. So that's the basic science behind how we see. Pretty cool, right? Now, just like with old film cameras, we want the retina to be a smooth, even layer so that it can create the clearest, least distorted image possible. When an epiretinal membrane forms, it's like crinkling up the film of a camera before using it, and it causes distortion in the image. So what vision changes happen when we have an epiretinal membrane? Well, the good news is that most people with ERMs have very mild ERMs, and many people with mild ERMs actually have no symptoms at all. However, someone with a more advanced epiretinal membrane may notice that their central vision isn't quite as sharp as it used to be. Fine details like small print or facial features can start to appear blurry or hazy, even with up-to-date and current glasses. One of the more common symptoms of ERMs is distortion in the vision. Straight lines might start to look wavy or bent, especially when looking at things like blinds, door frames, or text on a screen. Now, the medical jargon for this distortion is metamorphopsia. Try saying that one 10 times fast. In some cases, objects can start to appear a little smaller than they are, which is called micropsia. And patients with an ERM also can describe a sort of smudging or grayish area in their central vision, while their peripheral vision remains mostly unaffected. The severity of symptoms can really vary quite a bit depending on what that epiretinal membrane looks like, with some individuals at the mild end barely noticing anything at all, while others can find these changes interfere with their daily tasks like reading or driving. Just like any other health condition, epiretinal membranes exist on a spectrum from mild to severe, but epiretinal membranes as a whole are actually pretty common as we get older. In fact, most studies show that the prevalence of ERMs is around 10% in the older population. 10% means 1 in 10 people in the cataract age range have an epiretinal membrane. Now, oftentimes, your optometrist you've been seeing for years may be examining your eyes but not mention to you that you have an epiretinal membrane, especially if it's mild or very subtle on the exam. However, these days, when we're preparing for cataract surgery, we use advanced imaging technologies like an OCT macula, which scans the retina and gives us cross-sections. This technology often reveals epiretinal membranes we might not have realized were there when we're looking just with the bright light. Because of that, many patients learn they have an epiretinal membrane for the first time during that cataract surgery workup process. Understandably, that can cause a lot of fear and a lot of uncertainty. But let's talk a little bit more about the spectrum of severity. So a mild epiretinal membrane often doesn't affect the vision much at all, and the best way to see a mild ERM is with that OCT macula. It gives us a cross-section of the retina, almost like an ultrasound or an MRI for the back of the eye. First, let's look at a normal OCT macula of a healthy eye. So here we look at the central part of the retina, which is called the macula, which is responsible for our sharpest vision. In the very center of the macula is this little dip called the fovea, and that's what gives us our 20/20 central vision. Now, oftentimes you may not realize this, but your peripheral vision is actually pretty blurry, something around 2200 or so. Now, it's great for what it's supposed to do. You can detect motion, you have an idea of your surroundings, but you really wouldn't be able to read or even recognize faces very well with just your peripheral vision. Tasks like reading small print, driving, watching TV, all rely on that sharp central vision, which is what the fovea gives us. Now that we've looked at normal, let's look at the OCT of someone with a mild epiretinal membrane. So just examining the retina, you might barely notice any change at all, but with the OCT, we can see this new bright band on the top layer of the retina, and that's that epiretinal membrane itself. Importantly, you'll notice in mild cases that the membrane hasn't really distorted the shape of the retina. That little dip at the fovea is still there, so it's probably not affecting the vision much at this point. For someone with a mild ERM and a cataract, I'd expect the vision after cataract surgery to be very good. Most of the vision problems that patient's having are probably from the cataract itself. That said, even a mild epiretinal membrane makes us think a little bit more about what lens we want to use during cataract surgery. Because there's a chance that membrane might get worse in the future, I'm pretty cautious about recommending an extended range lens to a patient with an epiretinal membrane. Now, if you're wondering what the heck an extended range or multifocal lens is, or if you're mostly unfamiliar with the concept of the different lenses available during cataract surgery, fear not, because I've actually made a lens guide video that you can click above that walks you through exactly that. It goes through the different lens types available during cataract surgery and how they determine what your vision's going to be like after the surgery. In addition, I've actually made a downloadable lens guide that you can download totally for free just by scrolling down to the video description below and clicking the link. Now, moving up the spectrum of severity a little bit, let's talk about what a moderate ERM looks like. On OCT here, we can see that a moderate membrane appears a little bit thicker, but more importantly, it actually starts to distort the retina shape around the macula and the fovea. You'll notice a little bit of thickening of the macula, as well as the loss of that smooth dip or the normal contour to the fovea. A moderate epiretinal membrane can vary a lot in how much it affects the vision. Some patients may still see 20/20 or pretty close to it, whereas others it might start to limit their vision to something more like 20/40 or 20/60 because of those changes. Now typically we won't do anything to treat a moderate membrane, at least not right away, but it's something I always talk to my patients about before cataract surgery. If you have a moderate epiretinal membrane as well as a moderate cataract, I'd counsel you on what your vision's going to be like and how much it will likely improve after surgery. Oftentimes, I'll tell my patients, your vision may not get all the way back to 20/20, but it should be better than it is now from removing the cataract. Unfortunately, there's no precise way to know exactly how much of the vision loss is from the cataract versus how much is from the membrane, but your surgeon will use their expertise and experience to kind of give you the best estimate possible. In many cases, I'll tell my patients, let's do the cataract surgery first and see how much improvement we get. If you're still unhappy with your vision after cataract surgery, then we'll discuss seeing a retina specialist to evaluate this membrane a little bit further. Moving along to the severe end of the spectrum, in cases of a severe ERM, both the exam findings and the OCT show significant distortion of the retina. You may even see spots where the membrane has pulled enough on the retina to create a hole or a tear in the macula. A severe ERM almost always causes at least a moderate amount of vision loss and distortion. When I see something like this, I often want to get a retina specialist involved in seeing the patient even before I do cataract surgery. Again, I'm trying to guide the patient on how much of their vision loss is from the cataract versus how much is from the epiretinal membrane. Now, the good news is when an epiretinal membrane is this severe, there are some treatment options. Retinal surgeons can perform a surgery called a vitrectomy with a membrane peel, where they actually go in and they remove that membrane from the retina. This can help and allow the retina to return back closer to its normal shape. Now, it's important to note that even after a retina surgery, the retina may not go back to being completely normal. Oftentimes, the vision doesn't fully recover, but the surgery can lead to some meaningful improvement in the vision and prevent it from getting worse. If someone has both a cataract and a severe epiretinal membrane, I'll usually be coordinating with the retina specialist, but oftentimes they'll want us to do the cataract surgery first because that gives them a better view of the retina while they're doing their surgery. But because you've made it this far in the video, let me know in the comments below if you're dealing with an epiretinal membrane and if you've had or are getting ready for cataract surgery in the future. Other patients going through this process would definitely benefit from hearing what your experience was like. One last note for this video, as promised, let's talk a little bit more about what lens options are available during cataract surgery for patients with epiretinal membranes. Now, if you have a mild epiretinal membrane, extended range lenses are still on the table, but I tend to lean in favor of something like an extended depth of focus or EDOF lens rather than a multifocal lens. While EDOF lenses don't get quite as much range of vision as multifocal lenses, they're a lot more forgiving to anything else going on in the eyes, and particularly if that membrane gets worse in the future, you're going to be happy you have an EDOF lens rather than a multifocal lens. For patients with moderate and severe epiretinal membranes, I tend to recommend just a single range lens targeting the distance vision. Now, I think it still makes sense to correct astigmatism with something like manual LRIs, the use of a laser, or the use of a toric lens if it's needed. However, in these cases, I don't recommend those extended range lenses. We know those lenses cause some loss of contrast sensitivity at baseline, and if you already have another eye problem going on, like a moderate or severe epiretinal membrane, sometimes it can make it so those lenses don't work quite as well. So I hope this video has helped explain what an ERM is and how it can affect the cataract surgery process. If you or a loved one are getting ready for cataract surgery, make sure to subscribe to the channel. I'll be posting a whole series of videos on common eye diseases and how they can affect cataract surgery. Thanks again for watching, and as always, I'll see you in the next video.